everyone. Welcome to our first academic year monthly Integrative Psychiatry Zoom meeting. It is an absolute pleasure to see so many old and new faces gathering here. My name is Noshene Ranjbar. I am here with my co-host, Sister Amelia Villagomez, holding space for all of us today. I'm so glad people are introducing themselves on the chat because we could spend a long time having everyone share. But what we thought we would do is give a little intro about ourselves and this meeting and the history of this meeting, and then share what we wanted to share today, which is a series of resources that were recently compiled and put together. And then open it up to discussion and Q&A. And we thought that once people are asking questions and giving comments, then you could also introduce yourselves, whoever's speaking, so we can have a combination of getting to know each other, but also having plenty time. Amelia, would you like to introduce yourself if you haven't already?
I did briefly already, so I'll just say I'm Amelia Villagomez, co-director with Noshene of our Integrative Psych department at the U of A.
Great. Do you want to say, you already said where you are?
And Fort Worth, Texas, in private practice as well.
Great. Yes, and so I'm at the University of Arizona in Tucson and have been here for 8 years. And I wear a couple of hats, just like many of you, one being helping co-direct with Amelia the Integrative Psychiatry academic program here at U of A, and also support the many sites that are continuing to arise in integrative psychiatry curriculum around the country. We have 7 sites now. So we'll share a little bit more about that. I also do a lot of work with Native American and Indigenous and asylum-seeking individuals and communities through the Center for Mind-Body Medicine. And we also work very closely with the Andrew Weil Center for Integrative Medicine and the Integrative Psychiatry Institute. So if you are coming through any of those people or places or organizations or not, you're welcome here. And part of what we, the history of this meeting is that about 8 years ago, the Integrative Psychiatry program at U of A started in collaboration between the Department of Psychiatry and the Andrew Weil Center for Integrative Medicine. And we started to get lots of questions and requests from undergrads and medical students and residents around the country. Little by little, they advocated for many of them to have their own programs and their own adaptation of the curriculum from the U of A. But there are still many who had questions and needed a place to get to know each other, find out about the field as it grows, and also network and learn new things. So this meeting was initially created to have a space for more ways for people to get their questions answered and to continue the process of creating a community, a tribe around those early adopters of a holistic way of addressing psychiatry and mental health. And so that continues to be. And after a few months of holding the space, we realized that it would be so much more helpful if we had a little 10 to 20 minute presentation at each of these meetings. And so that's how we got to where we are now. So each time we invite somebody to give a talk on some aspect of integrative psychiatry, and that gets recorded in the YouTube playlist that we have put together that we can share the link with you all. And so that's a good way to showcase each of your expertise and continue to learn from each other as well. And I forgot that Janice is here. I'm so happy you're here. Would you like to introduce yourself?
Hi, I'm Janice Curtis. I am the program coordinator for the Integrative Medicine and Residency programs through the Andrew Weil Center for Integrative Medicine at the University of Arizona here in Tucson. So I work with Noshene and Amelia on the psychiatry part of the program. We also have programs in family medicine, OBGYN, internal medicine, and pediatrics.
Thank you for being here. We also have another amazing program coordinator, Ilana, who couldn't be here today, but you'll see emails from her as well as Janice from time to time, depending on what group you're part of. But if you're not on that listserv to receive the invitations for these monthly meetings, they will also be mentioned on the Facebook group, which is where a lot of you probably found out about this. But if you would like to be on the listserv, just email us and we can make sure that actually we'll put Ilana's email so that you can, Amelia, would you mind sharing? So great. Anything else, Amelia, you would like to say about how we got here or the history? Okay, you're muted. But I heard
I think
you.
that sums it up really well, and I will put a link into an article that we published about the life history of the program for integrative psychiatry at the U of A, in case anybody's interested in adapting a similar program at your institution. We kind of wrote up the steps that were done at ours.
Great. And I acknowledge that many of you are not on screen, and that's totally fine. And if at some point you can reveal yourself, we'd love to see you, but no pressure. So what we wanted to do, and I know Krishna is not here yet. She is a PGY2 resident at Southern Illinois University Psychiatry. And she is one of the trailblazers, like many of you here. I'm seeing Michelle Cross and Cedar and lots of our amazing fellows and residents around the globe. But she was actually the impetus for putting together this rather comprehensive resource list that now exists because of her initiative. And so we wanted to take this opportunity of this meeting to present that to, it's an organic living entity, so it continues to be updated as resources go away and new resources emerge. But I think this might be a good time to look at that together. I'll just say that, you know, the purpose of this document is to try to have everything in one place, because there's so many people kind of lost in the cyberspace of information. And the more research develops and more programs emerge, it is really hard to keep track of them. So consider the current version of this document. So it starts with committees, organizations, and kind of governing bodies of integrative medicine, integrative psychiatry, to kind of ground us in the big picture. And then it goes into training programs, books to consider reading, conferences to consider attending, Facebook groups to consider being part of. And it is, you know, free for anyone to access at any point. And it has a mention in the top that if you have a organization or a place or a Facebook group or something that you feel should belong on here, send it to us, to Ilana's email, and we will add it as long as it's within reason of evidence-based integrative psychiatry. We're trying to keep things as evidence-based as possible. So, so you'll see the kind of breadth of what we have so far. Amelia, do you want to start kind of going over?
Sure. So it's all hyperlinked, and at some point we will put the PDF that you can access, right, Noshene, in the chat box, because I wasn't able to find that. So this is the table of contents. We'll go through organizations, committees, conferences, textbooks, books, podcasts, people's work to follow, how to learn more, additional courses, residency programs that have the IMR psychiatry curriculum, online communities, integrative psychiatrist directory, websites, apps, handouts for patients, providers, and then conventional psychiatry CME platforms that review several integrative psychiatry topics. So we tried to be as thorough as possible. As far as organizations and committees, there are lots now that are doing work in this area, including ACAP. They have a committee on complementary and integrative medicine. ACIMH is the Academic Consortium for Integrative Medicine and Health. And you can go to their website. They have all the academic institutions that are a part of this consortium. They put on a conference every other year. And this is a really great group to get connected to see the other academic medical centers implementing integrative medicine in general. And we have a psychiatry subgroup as well that you can go on and learn and interact with. Another group is the AIHM, which is the Academy for Integrative Medicine and Health and Medicine. The APA has an annual meeting and also an integrative caucus. There's also IM for Us, which focuses on integrative medicine for the underserved. And there is the National Center for Complementary and Integrative Health, as well as the Psychedelic Medical Association. So those are some organizations and committees that you could go and look at what they're doing. There's also some of these groups put on conferences as well, including the AIHM, the Integrative Healthcare Symposium, the Integrative Medicine for Mental Health Conference, the Integrative Medicine for the Underserved, the Integrative Medicine Summit from the Andrew Weil Center for Integrative Medicine, the International Congress on Integrative Medicine. Psychiatry Redefined has several conferences and webinars. A lot of them are recorded, as well as the Semel Institute for Neuroscience and Human Behavior out of UCLA, as well as the UCLA Conference on Integrative Medicine and Mental Health and the Walsh Institute. So this is a list of conferences and webinars, and now in the age of Zoom, a lot of this information is online from recorded conferences. So another way to get great information. As far as some really key textbooks to dive into integrative medicine, James Lake, who is in many respects a grandfather for this field, an integrative paradigm for mental health care, ideas and methods shaping the future. And one of also the book Complementary and Integrative Therapies for Mental Health and Aging. The American Psychiatric Publishing Press put a book together that is fabulous, Complementary and Integrative Treatments in Psychiatric Practice. That's a go-to on my table all the time. And also the Psychiatric Clinics of North America, Complementary and Integrative Therapies for Psychiatric Disorders. And I think you can get a lot of those articles through PubMed. So other books, How to Use Herbs, Nutrients, and Yoga in Mental Health. Dr. Richard Brown, Patricia Garbarg, and Philip Muskin has done a lot of great work. You can go on YouTube and find a lot of stuff that they've put out there, but they've been really generous in publishing and putting out a lot of free information on their websites as well. There's a great book, Integrative Rehabilitation Practice, The Foundations of Whole Person Care for Healthcare Professionals by Arlene Schmidt and Matt Erb. And then also great ones, Scott Shannon, who grandfather in integrative pediatric pediatric integrative psychiatry, mental health for the whole child, moving young clients from disease and disorders to balance and wellness. And again, that's certainly one on my shelf that I look to regularly. And James Gordon, Dr. James Gordon, who founded the CMBM model and program, has written recently The Transformation, which is also a great book to read about trauma and an integrative approach to it, as well as to share with our patients. Podcasts are another way I know many of us like to learn on the go. Body of Wonder is put on by the Andrew Weil Center for Integrative Medicine, and those are some excellent podcasts. Recently, they did one on cooking oils, and that was a lot of really interesting information. They've done some on psychedelics and fasting and top-notch information. Andrew Weil co-hosts that with Victoria Mazes. And then the Carlat report, they are non-biased from non-pharmaceutical funded CME provider that has podcasts and also a newsletter that comes out, and they review a lot of integrative approaches on there. I know Selexin, micronutrients, Dr. Richard Brown recently did an interview there. So lots of good stuff, as well as the Integrative Psychiatry Institute podcast, psychedelic medicine podcast, psychiatry and psychotherapy podcast, the doctor's pharmacy. So this is just a couple, there's lots more out there, but somewhere to get started. And then lots of works of people to follow. These are some of the many leaders in the field. Just kind of put those together. We won't go through those individually. And Noshene, I can continue, but do you want to add anything? I'll pause if there's anything you want to edit or add.
No, sounds great. But we thought we'd kind of go over this and then open it up so you guys can decide what we talk about more. But I think, do you want me to share, or are you okay to continue?
I'm fine to keep going. As far as places to go that are structured in their learning, the Andrew Weil Center offers lots of fabulous courses. There's also a fellowship program that's 1,000 hours, and it doing the Andrew Weil Center for Integrative Medicine fellowship. Sorry, that's fellowship later on, but I mentioned it here too. They have courses online that are from their fellowship, and by doing the fellowship, one can also be approved for board certification in integrative medicine. That's really exciting that that's available now through the American Board of Integrative Medicine, which is a American Board of Physician Specialties board. And there's a textbook there for the exam. The Institute of Functional Medicine also has a lot of great courses, as well as the Psychiatry Institute and Psychiatry Redefined with James Greenblatt, who's put on a lot of free material as well as webinars, and he also has a fabulous fellowship. There is Mind Body Medicine to do the deep dive there through Breath, Body, and Mind. That's with Patricia Garbarg's group, as well as the Nova Institute and the Center for Mind Body Medicine that we spoke briefly about, that has 2 5-day trainings. And after that, you can lead groups in mind body medicine. It's a very structured approach to teaching and learning mind body medicine. Okay, lots of other courses. There's so much to learn, but I'll just highlight a couple of them. Accelerated resolution therapy is a therapy I practice and have found life-changing for my practice, for my patients. It's focused on therapy. It's very similar to EMDR, easy to learn, and I can't speak highly of it enough. I love, love, love doing ART, so I had to put that on the top of the list, and alphabetically it comes first, so that's convenient too. Acupuncture, biodynamic medicine, Center for Mindfulness and Compassion, compassion-based cognitive therapy, compassion inquiry, craniosacral therapy, emotional freedom technique, EMDR, heart math, heart rhythms meditation, internal family systems, mindfulness-based cognitive therapy, myofascial release, narrative medicine, osteopathic manipulation therapies, where you can find it in different places to get trained, psychedelic training, somatic experiencing, the Center for Mind Body Medicine, and transcendental meditation. So I know we're going through a ton of information, and there's all hyperlinks here. My hope is that as we're going through this list, you might just notice if there's an internal prompting somewhere along the line that says, oh, maybe I should check that out. Just kind of notice that and pay attention to it. That's how I learned about ART. Somebody just told me sitting next to me at a conference, and as soon as they said it, I was like, I don't know what that is, but I want to learn it. So as we're going through this list, I just invite you to notice what might kind of just pique your interest and pay attention to that. Sometimes that's typically how I make my first step approach of trying something new. Okay, so as we spoke earlier, the Andrew Weil Center for Integrative Medicine has a 1,000-hour fellowship, and it's typically, although not always, for physicians and clinicians who have graduated their training. And then for residents in training, they took that 1,000-hour program and have offered it in various residency programs in a shortened version of 1 to 200 hours in family medicine and pediatrics. And then Noshene and I have been working on bringing the 100 hours or 109 hours that are most relevant to psychiatry, creating encapsulating that, and they're started at the University of Arizona and now at other sites at that you have here. So Des Moines, Loyola, University of Arizona, University of New Mexico, University of South Florida, and Zucker Northwell Medical Center. Noshene, I'll pause in case you want to mention anything else before I get to the end.
No, you're doing great. Go for it.
As far as online communities, Noshene and I both are admins on the Integrative Psychiatry Facebook group. I know Facebook has lots of pros and cons, but the one pro is that it's easy to access, and there's, I think we have about almost 2,000 members all over the world, and it's for MD and DOs as well as medical students. There's also the Integrative Psychiatry Practitioner Forum Facebook group, which is open to all specialties. There's Integrative Psychiatry in Academia, which are our monthly meetings. Twitter also has Integrative Psych, and we have our YouTube playlist, which I also put in the chat earlier, as well as the Integrative Psychiatry Institute has a great community if you're a part of their fellowship program. Integrative Psychiatrist Directory, often these some great ones through Journey Dreams Practitioner Directory, as well as Same Here Global Psychiatry Directory, and Same Here is doing a lot of advocacy work to educate people about integrative psychiatry. So you can go on there and learn lots and see who's in that directory. As far as websites, Consumer Labs is a great resource. But be aware that businesses can pay for better reviews. That's a interesting point to know, but Consumer Labs will review supplements and look for purity and cost effectiveness. Examine.com is free from our Canadian colleagues. They do a great job of reviewing various supplements and grading them based on safety and efficacy. And then Natural Medicine Database, which is available through most academic centers' online library access. And then handouts for patients. Capacitar has a great mind-body medicine technique in emergencies handbook. Fabulous. I love the way they explain emotional freedom technique and other techniques in there. It's about a 12-page handbook, and it's in maybe 20 different languages on their website. Integrative health teaching modules and handouts, as well as the Santa Rosa Family Medicine Residency Program has great handouts, and the Whole Health Library from the Veterans Administration. And as you all might know, the VA is really focusing on holistic health and has created a plethora of handouts and information for us. And then conventional psychiatry CME platforms that review several integrative psychiatry topics. This is really exciting because it really gets it into the hands of the general, the average psychiatrist, average clinician out there who's just kind of seeing what's new and improved and learning about, you know, the newest antipsychotic medication right alongside Selexin, or the recent research on micronutrients, for example. So the Carlat report, I think, does a fabulous job looking at a lot of integrative therapies out there, as well as Psychiatry Education Forum. Really, all of these are very practical, very easy to digest and meant for clinicians, as well as the Psychopharmacology Institute and Simple and Practical. I love Simple and Practical. They send daily email messages, and they live up to their name for sure. And for residents and medical students, for all of these are discounts. And then lastly, we'll just go through some apps that we recommend often to our patients: Better Sleep, Healthy Minds Program, Insight Timer, and Headspace. So with that, I will pause. And
I just noticed that Krishna joined us. So maybe Krishna, you can introduce yourself and tell us why you came up with the idea of putting this together.
Sure. Hello, everyone. My name is Krishna. I am a PGY2 psychiatry resident at SIU in Springfield, and I've been working in the integrative psychiatry community with Dr. Ranjbar and Dr. Villagomez for several years now. I guess I started my journey in integrative medicine many years prior to even coming into medicine, and that's what inspired me to go to med school. But formally, I didn't know this field existed and all the resources out there, and that's what started this project, to make it easier for all of us to have access to all the resources that are out there, have a comprehensive list, because the first question, firstly, people don't know this field exists until we talk about it as much. And then when they do, they're like, oh my God, how do we learn more? Where do we go? So that's why this project was created, so it can make it easier for us to access information for ourselves, even though we have been in the community, and share with our colleagues and peers. It is, of course, a project in process. We're still building the list. We're still adding more resources. This was just the first draft. So if you have any more ideas, any corrections, any things that you think should be added to it, please feel free to reach out to Elena. Her email ID is on the top of the resources document. And ever so frequently, we will go back and revise and make a new edition so that it's an updated resource for all of us.